Peter Block here at TCT 2015 for On the Scene, and with me is Dr. Danny Dvir from Vancouver, Canada. Danny has just reported on the Partner 2 valve-in-valve trial. So, Danny, valve-in-valve business is always tricky, a little bit difficult technically. You have to be sure you get it in the right place and so forth. Tell me what your trial showed.
So the trial includes 197 patients with failed aortic bioprosthesis treated by SAPIEN XT, high-risk patients, average STS of 10%, and the average age of 80 years of age. The primary endpoint was 1 year mortality.
So just to be sure everybody understands, this is aortic valve replacement inside of a previous surgically placed aortic valve, correct?
Absolutely, valve-in-valve of having SAPIEN XT treating a failed aortic surgical valve.
Okay. Difficult patients, they're all elderly, they're all high risk, they all have STS scores greater than 10. Tell me what the outcomes were.
The outcomes were outstanding, and this is, I think, one of the surprises that were coming out of the study. Very high-risk group of patients, all of them had a need for redo surgery, and the 1 year mortality was 13.2%, which is quite good for such a high-risk group of patients. In the second group of 100 patients included in the trial, 0% 30-day mortality. 0%, no one died. Out of, in 1 year, it was 7.2 mortality, so in 1 year. So it seems like a very, very promising results for a new indication for TAVI.
Okay, so the whole business of valve-in-valve is certainly moving forward. As you look forward to how all of this technology will go forward as well, with even more user-friendly valves, what do you see going forward? Do you think that this is going to be the standard way to dealing with failed prostheses?
Looking at centers doing valve-in-valves in Europe and also other countries, we know that there is a trend for treating lower-risk patients with failed surgical valves with a TAVI, having valve-in-valves in younger patients. And it seems that we are not far from the day that the vast majority of patients with failed aortic bioprosthesis, in my opinion, will be treated by TAVI.
Well, that's a pretty good and very positive statement. So valve-in-valve seems here to say we have good results from this trial, and I can't imagine that a 0% mortality at 30%, that's pretty hard to beat, and even 7% at 1 year is hard to beat for these high-risk patients. Thank you very much.
Thank you very much.
Very promising results for valve-in-valve implantation.